An epidemic of cholera has hit the Democratic Republic of Congo and affected new areas where it has never stricken before in the country's 26 provinces. Zambia is also battling cholera, but observers say the situation there has been contained. This is Camp Luka in Kinshasa, the capital city of the Democratic Republic of Congo. Thousands of locals here remain at risk due to the recent outbreak of cholera.
My mother has been in the hospital. I can't even look at her. She was throwing up and had intense diarrhea. And we don't know if we might lose her.
Those who deal with their case at home and arrive here late are extremely dehydrated. As soon as they are admitted, by the time you put a drip in their arm, they might die. Because back at home, they had already lost a lot of water and did not compensate by drinking it.
The latest cholera outbreak has affected 24 of the 26 provinces beyond Kinshasa. The highly infectious disease thrives in environments of poor sanitation, contaminated food and water. Most people recover from cholera if treated promptly with oral rehydration salts, but can die within hours if not. To contain this epidemic, the government has opened free treatment centers across the city. Zambia, DR Congo's southern neighbor, is also battling with a cholera outbreak. In a desperate measure to the outbreak, the government ordered immediate closure of all food and retail outlets in the country's capital, Lusaka. Street vending and public gatherings have also been banned.
Business has become slow because of this disease. We depend on these businesses to take our children to school. We can't afford to be staying at home because we'll just starve. We just want to ensure that the market is clean so we can continue operating as usual.
Authorities report that there has been a total of 3,260 cases and 74 deaths countrywide. They say figures are, however, scaling down as the country started vaccinations against the disease, targeting 2 million people.
After an initial downward trend, then the cholera cases started intensifying again in early November, and health authorities reached out to WHO for more support, including helping with a request for 2 million doses of oral cholera vaccine from the global stockpile. WHO helped the government put together the plan for this and trained about 500 health and community workers in how to administer the vaccine.
The United Nations has raised the emergency level of this situation in the two countries to a maximum. Whether this action will reverse the situations is a matter of wait and see as to just how this translates in the territory. And joining us in the studio now for more on the subject is Danielle Resnick, a senior research fellow with the International Food Policy Research Institute's Development Strategies and Governance Division. Ms. Resnick, welcome to the show.
Thank you for having me.
So DRC is very much battling the outbreak of cholera. Things seem to be getting better in Zambia. Let's focus on Zambia. What can we learn in terms of how they were able to get to where they are now with being able to decrease the numbers?
Well, I think as your story was showing already, they called on the WHO and other international health authorities to help them. Earlier this month, around January 10th, the WHO came in with about 2 million oral rehydration vaccines, and they've set up a cholera treatment hospital. So I think by getting that international assistance and the oral rehydration therapy, which works almost instantly, that's been a key part in solving the crisis.
But there are some people who say, even though things are looking better in Zambia, it is not time to relax, right?
Yes, that's absolutely true. Zambia, and particularly Lusaka, the capital, has been hit with these cholera outbreaks almost every year since the early 1990s. So we know that this is a recurrent issue, that even though the crisis seems to be waning, it reoccurs every year during the rainy season, which is from around October to April.
So if it's a recurring issue, what is the problem? Why is it that when every time there is an outbreak, it seems like no one is prepared for it? Where is the problem?
Well, there's a massive sanitation deficit in Lusaka. You have many of the residents in the city are living in what are called shanty compounds. So these are either informal, some are unauthorized settlements around the central business district of the city. Many of them they're not connected to any sanitation or sewage system. The largest compound has about 24,000 pit latrines. And so during the rainy season, these often overflow, and you have a mixing of human waste with the water system.
So it seems to show a disparity in terms of access to sanitation and hygiene.
Absolutely, yes. Lusaka is a very unequal city, and you have about 85% of your kind of richest population have access to good sanitation and clean water, and only about 10% of the poorest segment of the population.
We've seen some very strong perhaps measures that the government took. They send in the military at some point, they close down the street vendors. So what is your take on that and how effective these were?
I don't think it's very effective. I think it's a very reactive measure in a crisis situation. Shutting down basically the place of business for almost 80% of the city's residents is not a good idea. This is where they get most of their income. I think a better solution is actually teaching street vendors, marketeers good hygiene practices, safe food handling practices, and actually bringing some of the sanitation and potable water into the marketplaces. That's a better solution than bringing in the military to crack down on very poor people.
So then, moving forward, given that this is an issue that happens every year, it's recurring, so what should be done differently, and what can other countries learn from Zambia? Because we see this happening in DRC and other countries also going through cholera outbreaks. What are the lessons to be learned here?
Well, Zambia is a bit unique compared to DRC, where a lot of it's been in the conflict areas. Zambia is a peaceful country. It's one of the wealthiest countries that's been affected by this cholera outbreak. And so one of the solutions is upgrading the sanitation system, bringing in potable, clean water, informing people of safe food handling practices in advance. Zambia is working with a number of donors to upgrade sanitation in Lusaka, but the challenge is it's very expensive, it's a very long-term measure, and as I mentioned, many of these, you have a large share of the population in these informal settlements, so it would involve some displacement of these populations to upgrade the housing infrastructure. But we do need to plan in advance. We do need to think about bringing in sanitation practices into places of work as well as in housing communities.
Prevention is definitely better than care, as we hear very often.
Yes, absolutely.
And before we wrap very quickly, in terms of appropriate regulation for informal markets and as it relates to health, or what would you say quickly that would be some perhaps 1 or 2 steps?
I think absolutely these markets need drainage. In the rainy season, there's no drainage, no place for the rainwater to go. And so you often have vendors sitting on the ground in the mud, selling produce, fresh fruits and vegetables in the mud because there's no drainage. So I think bringing in drainage. And then I think you need to have some type of potable water and hand washing, soap, in a lot of these markets where they are selling fresh foods. And often these are just washed in the rainwater. So those would be the 2, if we really limit it to 2, those would be the 2 I'd focus on.
Okay, Danielle Resnick, thank you so much for joining us today.
Welcome.